right, Needs for Tots is a print and web-based curriculum designed to educate kids, parents, and preschool providers on the principles of the Division of Responsibility in Feeding and USDA core nutrition messages. Wait, what? Breaking it all down for us is Elizabeth Reuter from RIT's Wegmans School of Health and Nutrition. She's an associate professor and spearheading a lot of this program. That's a lot. Moms are like, all right, what do I need to know for when I'm trying to tell my kid to eat broccoli and they're not eating broccoli? You say you've brought this program in to work with some preschool kids, is that right?
Right. We're currently piloting this program at the Volunteers of America Children's Center on Lake Avenue. There are 16 classrooms participating and reaching about 250 to 280 kids.
Yeah. And so the principles are pretty basic, or they get really in-depth?
Well, it might be a little counterintuitive to the way maybe we were raised as kids. So this division of responsibility in feeding is all about balancing the parent or caregiver leadership in feeding with the child's autonomy in eating, which means that the parent or caregiver is going to take responsibility and be in charge of determining when meals and snacks are going to be available, and what foods are going to be available at that meal or snack time. And then the child then has autonomy, or the child has responsibility for deciding from those foods what are they actually going to eat and how much of those foods they're going to eat. So the child has some distinct responsibilities from what the parent or teacher has responsibility for.
What prompted you to take this on? Why? What was the deciding factor? We need something like this to really assist parents.
Well, this curriculum was actually developed by my colleague, Dr. Barbara Losi at the Wegmans School of Health and Nutrition at RIT. And a lot of this was based off of her research in this division of responsibility in feeding that kind of showed that we need a new approach to the way that we feed kids. And I should mention that this division of responsibility in feeding actually was developed by Ellen Satter, who's a social worker and registered dietitian that a lot of pediatricians will recommend her books to their clients.
So I'm trying to think of when I was a kid, it was like if Lucy put the food out, I had to eat it, and pretty much. And if I didn't, she was like, you will eat it, right? And so I was like, okay. You're saying don't force kids to eat, right? Give the kid autonomy. Let them choose themselves. What benefit is that to the child?
Well, this is setting up that the child needs to learn how to feed themselves, and you're providing that environment. So you as the parent, you decide the foods that are going to be on the table.
That's fair, yeah.
But then the child can decide from that what they're going to eat and how much.
Okay, but that's hard for a mom.
It's really hard.
Because you're like, no, you will eat this or you're going to go hungry, right?
Well, we do know that healthy kids won't starve themselves. And that eating is, it's a learning experience, and they need to have this exposure to this to figure out what foods they like, which foods they don't like, and to know that they're in charge of, from these foods that you have provided on the table, they're in charge of deciding what they're going to eat.
All right, let's just give an example, because I'm wondering how many different choices. So say at dinner time, is it a choice for the main course? Is it choices with, within main course, side dish? What's a good example?
So we would say that everybody at the table is going to be eating the same types of foods or have the same choices, so that it's not like you put out some chicken fingers for the kids and mom eats something else. But, there are likely going to be many components to that meal. So there might be a main course, a bread, a salad, and the child can decide from that what they're going to eat. So it might be that they skip one of those parts, but we would say don't give up. Keep putting that on the table, the vegetable or something that might not be as preferred, and that with repeated exposure, the child will learn to accept that food.
Okay, that will happen.
It will happen.
I keep waiting for it to happen.
So be patient, really, then, with your child if they eat the bread only and not maybe the main course or the vegetables. Like we said, hopefully. This is being studied, right, through the VOA's Children's Center. When will you get your findings finalized and present your final studies?
Well, the teachers just finished up teaching the curriculum on Friday.
Oh, okay.
And now both the parents and the teachers will be doing some follow-up surveys, and we'll have those data available by springtime.
Okay,
can't wait.
Healthy habits when it comes to food, though. Creating a healthy attachment to food.
A healthy attachment and enjoyable attachment so that mealtime is pleasant.
Yeah. No food on the wall.
On the floor. I just remember it was so top down. It was like, you will eat this.
Yeah. This reminds me of all the ways I tried to get out of eating my food and the ways I snuck it out of the dining room.
Yeah. Pets are always very helpful.
Yes. Yes.
So are napkins. And
And the toilet.
Don't tell the kids mom. Stop. Will you come back in the spring and let us know what you find out?
This is so interesting.
Okay.
Yeah.
Wow. Just like you said it's different than the way we grew up.
Mm-hmm. Sure is.
And there's a website we're looking at. What's the address if people want to find out a little bit more?
You go to needscenter.org.
Needscenter.org.